Hello and welcome. Today we'll be discussing renal laceration, a serious injury to the kidney that can have significant health consequences. We'll cover what it is, how it happens, how it's diagnosed, and what can be done about it. So, what causes a renal laceration? The primary culprit is trauma to the abdomen or flank. This can stem from motor vehicle accidents, falls from a height, direct blows during contact sports, or even penetrating injuries like gunshot or stab wounds. The severity of the laceration depends on the force of the impact and the presence of any underlying kidney disease that may make the organ more vulnerable. Let's delve into the pathophysiology. A renal laceration involves a tear in the kidney tissue, potentially disrupting its intricate structure. The severity of the tear dictates the extent of damage to the renal parenchyma, which is the functional tissue of the kidney responsible for filtering waste and producing urine. Blood vessels within the kidney are often disrupted, leading to bleeding and hematoma formation. Urine may also leak from the damaged kidney into the surrounding tissues, a condition known as urinoma. This leakage can cause inflammation and further damage to the surrounding structures. When we look at the epidemiology of renal lacerations, we see that they typically occur in the context of broader trauma incidents. Therefore, they're more common in younger individuals, particularly males, due to their higher likelihood of being involved in accidents and high-impact activities. The incidence varies depending on factors such as geographic location, population density, and access to trauma care. It's also worth noting that patients with pre-existing kidney conditions may be at a higher risk for more severe lacerations even with relatively minor trauma. Now let's explore the signs and symptoms. The symptoms of renal laceration can vary depending on the severity of the injury. Common indicators include flank pain, which can range from mild discomfort to excruciating agony. Visible blood in the urine, known as hematuria, is another frequent sign. Bruising or swelling in the flank area may also be present. In severe cases, the patient may experience signs of shock, such as rapid heart rate, low blood pressure, and altered mental status due to significant blood loss. Diagnosis of a renal laceration typically involves a combination of physical examination, imaging studies, and laboratory tests. A thorough physical examination helps assess the extent of pain and tenderness. Urinalysis is performed to detect the presence of blood in the urine. Imaging studies, such as CT scans with intravenous contrast, are crucial for visualizing the kidney and identifying the location and severity of the laceration. In some cases, an intravenous pyelogram or angiography may be used to further evaluate the renal vasculature. Renal lacerations are often classified based on the severity of the injury, typically using a grading system from I to V. Grade I lacerations are minor contusions or hematomas without any capsular tear. Grade II involves lacerations less than 1 tum deep without urinary extravasation. Grade SI lacerations are greater than 1 cm deep without urinary extravasation. Grade IV lacerations involve the collecting system, potentially leading to urinary extravasation. Grade V injuries are the most severe, involving shattered kidneys or avulsion of the renal hilum, which is where the blood vessels and ureter enter the kidney. The treatment and management of renal lacerations depend on the severity of the injury and the patient's overall condition. Minor lacerations, such as grade I and II, may be managed conservatively with bed rest, pain medication, and close monitoring. More severe lacerations, particularly those involving significant bleeding or urinary extravasation, may require surgical intervention. Surgical options include exploration and repair of the kidney, partial nephrectomy, removal of part of the kidney, or in the most severe cases, total nephrectomy, removal of the entire kidney. Angioembolization, a minimally invasive procedure to block off bleeding vessels, may also be used. Preventing renal lacerations is primarily focused on preventing the traumatic events that cause them. This includes safe driving practices, wearing seatbelts, taking precautions during sports activities, and creating safe environments to prevent falls. In high-risk industries or activities, proper protective equipment can also significantly reduce the risk of renal injury. The prognosis for renal laceration depends on the severity of the injury, the patient's overall health, and the promptness and effectiveness of treatment. Minor lacerations typically heal well with conservative management, and long-term kidney function is usually preserved. More severe lacerations may result in complications such as chronic pain, hypertension, or impaired kidney function. Recent research is focused on developing less invasive surgical techniques and improving imaging modalities for more accurate diagnosis and management of renal lacerations. Minimally invasive techniques are also constantly being improved for shorter healing times. The field is also continuously researching new ways to reconstruct and save kidneys, especially those that would have previously required removal.